Look, at the end of the day, advances in medicine have to come from having good quality evidence for what we do. Unfortunately, all medical treatment imposes toxicity, it imposes side effects on our patients. It can cause suffering if not used correctly. And the only way to find out if what we do is meaningful to patients, if it's going to change their lives for the better, is to do high quality clinical trials. And you can't do these in isolation. Clinical trials are difficult to perform, they demand high levels of scrutiny, high levels of resources, and they're very expensive. And I think TROG has been very, very successful over the years at developing the infrastructure and the resources that we need to be able to carry out good clinical trials. I think this is peer review in kind of its purest and best form, in the sense that any full member of TROG can bring an idea here and they have to write up a proposal justifying what they're going to do, and then they have to present it to their peers and get feedback on that in an open forum. It's often easy, an idea is an easy thing to have, but to develop that into an actual plan which can be carried out and completed, and then develop results from that plan, that's a very difficult thing to do. So this is a whole bunch of people giving up their time and energy to share what they think is important and to give you free advice on your research. And it's true, it's a very, very engaging process. It's also a very demanding process for young investigators, but it is, to some extent, I think also a rite of passage as a researcher. You have to be able to present your ideas coherently, you have to be able to defend what you're going to do, and you have to be able to demonstrate why it's worthwhile to your peers and then to your patients. And that is really the essence of high quality research. So the ASM, I guess, it is such a core part of that process. There are things here that you cannot replicate through the internet or via email. You have to meet face to face to have those discussions.